They have trouble qualifying for good jobs, keeping good jobs, and moving ahead in their careers. When they are too old to work, they are less likely to have adequate pension plans. And they also have a harder time just providing for themselves, much less accumulating and passing along wealth, family wealth from generation to generation. Now let me be clear, and as clear as I can be. Healthcare is not only a problem for racial and ethnic minorities. Healthcare is a problem for the great majority of Americans. Healthcare is not only a problem for low-income Americans. Healthcare is a problem for the middle class as well. And healthcare is not only a civil rights issue. Healthcare is an urgent economic issue for our families, for our companies, and for our country's capacity to compete in the global marketplace. Now, that is why healthcare reform is at the forefront of public consciousness. Polls consistently show healthcare is a top concern for voters, forcing it to be a concern for every serious presidential candidate. Now, last week at the Democratic presidential candidates debate, there were heated exchanges over healthcare. Each candidate tried to assure voters that his or her plan would cover everyone, although unfortunately they were quick to point out that universal health care doesn't include millions of undocumented immigrants, doesn't include them. While the fireworks at the debate were just about insurance coverage, we all know that reforming the American health care system is a far more complex problem. A comprehensive approach that simultaneously addresses access, cost, and quality is the only solution that can work. We understand that access means not just who is covered by insurance, but also the practical availability of care in underserved communities. Similarly, addressing cost is about more than just the price of an insurance policy and individual co-payments. It's also about the root causes of the costs. There is inefficiency. There is the failure to focus on preventive care and health maintenance. And there are also perverse incentives, sometimes even the overinsurance that encourages doctors and patients to use far more expensive tests and drugs than are needed. Finally, we must focus on improving quality. Without quality health care, none of the other improvements that we need would matter very much. After all, what good are we doing if we make health care affordable and available if we also don't make it good? Okay? If we don't make it good. You know, now, as a longtime civil rights lawyer, I can tell you that it's a lot easier to determine what inequality is than to determine what quality is, okay? Appropriately, the most recent Democratic candidates' debate was on Martin Luther King's holiday. And as Dr. King often said, it's always the right time to do what is right. Always the right time. So as disturbing as the problems are, this is the right time to call attention to the healthcare crisis, to propose answers, and to mobilize a movement to demand action. That's what you all are doing here with Families USA. You are mobilizing a movement to demand action, and I can assure you that your work will not go in vain. It is striking a responsive chord all across the country. Now, in this election year, the public, the media, and the candidates are all focused on the problem and the need for radical changes. During the debate, Senator Obama was questioned about his support for a single-payer system. Senator Clinton has often been asked about her experience in trying to solve the problem. And Senator Edwards has also offered a comprehensive plan. Obviously, the Republicans have also faced similar questions. Regardless of whether you like Senator McCain or Rudy Giuliani or Mike Huckabee, the issues remain the same. And this is not a partisan issue. This is a national issue, and it has to be seen in that light. Now, instead of playing gotcha about who said what, Maybe it's time we took a serious look at every possible solution to this social and economic crisis. It's time to take a look at Congressman John Conyers' single-payer bill. Time to take a look at it. Some of you know it's called the United States National Health Insurance Act. For a comprehensive approach to the disparities that are rife throughout the system, it's time to take a look at the House Tri-Caucus Plan, which is a bipartisan bill called the Health Equity and Accountability Act. And rather than dismiss these ideas as being too liberal, it's also time to challenge the moderates and conservatives to come up with their own proposals. Okay. Now, it is the right time to take the same creativity and ingenuity that has advanced the science of medicine and apply it to making these modern miracles accessible and affordable for every American. It is the right time to speak the simple truth that people have a civil and human right to quality health care. And it is the right time for the American people to join together across the lines of color and class, ethnicity and ideology to demand that our nation's leaders address this challenge. Reforming our health care system is the right thing to do. The time is right to get it done. And now it is up to all of us to build a movement to make the most of this moment. I want to thank all of you for everything that you have done, for everything that you are doing, and for inviting me to this hopeful and historic conference. The truth is, the right time for health care is now. And I feel that by being here today, I have been part of the burgeoning movement that will ultimately lead this country to do the right thing. Thank you very much.